and gentlemen, I'm so honored and excited to host Ismail Özsoy. He is an amazing professor. He is one of the key members of the Turkish Academy of Sciences. And today, you know what we will talk about? We'll talk about nanotechnology in healthcare. Ismail, welcome to our show, Global Health. How are you today?
Thank you very much, Dr. Salai, for inviting me one more time to your broadcasting. Actually, I'm doing well. I hope that you are doing well also too.
Well, I had to call you back to this show because we received so many messages, so many WhatsApp messages from Kenya, Tanzania, Nigeria, Ghana, as well as Mali, and they're asking so many questions. I said, okay, I'll do another episode about healthcare and nanotechnology. Especially one of the questions that came from Nigeria, they asked about the advantages of nanotechnology in healthcare compared to traditional treatments. Can you shed some light on this, dear Ismail?
Absolutely. First of all, thank you very much for this great news from all over the Africa. Several countries you said to send a message. That means Africa is calling you probably next years.
Absolutely.
To visit some African countries together, I guess.
We will, definitely. I would love to go with you together.
Yeah, inshallah.
Inshallah.
Actually, Dr. Salai, when we say the nanomaterials or nanotechnologies, we have a chance to functionalize surface of nanomaterials or nanodrugs with targeted ligands. In other words, we have a chance to produce smart and targeted drugs. If we produce targeted and smart drugs, we have a chance to quite active therapies against different types of actual treatments. And the other thing is that in terms of the nanoscale, we have a chance to load high concentration of biological molecules or drugs or any target molecules in the nanoscale treatment systems. When we have this local high concentration in nanoscale, that means we have enhanced and then synergistic effects for treatment of, as I said, different types of disease with these nanomaterials.
Amazing. So this is amazing because if you're able to use it, this will give huge advantage in nanotechnology in healthcare compared to traditional treatments from pharmaceutical to different types of even medical devices as well as procedures where you're using gold particles, as I remember. So let's talk about the nanomaterials, Professor Özsoy. How do nanomaterials interact with the biological systems as far as you see?
Well, actually, this key questions. Actually, several years ago, I would say, an OECD, and the Economic Cooperation and Development Organization, initiated one program. It's called Manufacture Nanomaterials Working Parts. The meaning that OECD says that please try to use nanomaterials as a drugs in actually animals models, even in human.
Wow.
And that was the first initiative actually started in 2006. After that, ISO, International Organization for Standardization, also supports, just give support actually for these initiatives. Because we, as you know, that we should develop actually novel and new generation drugs compared to traditional treatment systems. But when we apply or use nanomaterials with animals or for human, we have to follow four steps. One step is administration of these nanomaterials. Mm-hmm. So how we can apply it based on the nanomaterials and based upon their formulations, like nasal application, dermal, intratumoral, subcutaneous, inhalation, oral. These administration steps is as quite important based upon the formulation of nanomaterials. Mm-hmm. Because our aim is to apply these nanomaterials properly and receive much gain. Actually, Second step is distribution of the nanomaterials. After we apply nanomaterials into animal or human, how about the distribution of nanomaterials in body?
Mhm.
That's another key point. Uh, how we control distribution based upon the active, that, and also passive targeting.
I
The
see.
passive targeting, that means we don't have any ligands,
Mhm.
targeted ligands,
Mhm.
to specifically recognize the problem places or problem points in the human or animals. Due to that, we have to functionalize the nanomaterials with targeted ligands, for example, DNA aptamers or antibodies, some specific actual peptide, RGD peptide something. We have to use them to functionalize surface of nanodrugs for make them active targeting. The third step is metabolism. So that's another key point. After we uh, functionalize the nanomaterial with the target ligands, how about the metabolism of these materials inside the like human or animal body? Now,
Mhm.
where they go after fix the problems? Like they may accumulate in like kidney, spleen, or liver. Well, we have to think about it.
Mhm.
Like what happened after we use nanomaterials as a drugs. The last steps is also its eliminations.
Yes,
The clearance steps is also quite important for using nanomaterials.
I see.
Uh, in terms of the interaction, we definitely go for uh, phagocytosis systems. Like what phagocytosis and also pinocytosis, that. So how we determine it? Size of the nanomaterials is a key point for determining phagocytosis or pinocytosis or interaction of nanomaterials with animals, with even with the cells. Uh, how the size we control? If we have actually nanomaterial size over 150 nanometers, 150, it's better to go for macro pinocytosis. Uh, if we decrease size of the nanomaterials below 50 nanometers, it's
Mhm.
better to use endocytosis and receptor binding systems for these small size nanomaterials.
Amazing. So this is phenomenal. It looks like nanotechnology is not just a drug delivery platform, it's a beyond methodology. It has become a serious enabler of key solutions. And when we look at cancer treatment, I'm very curious as a physician, how is the nanotechnology is used in cancer treatment? I know some products like Abraxane and others, but I'm very curious how you see the current and future of nanotechnology for cancer treatment.
Yeah, definitely. Thank you very much again for this question. Also, is quite actually crucial point. Uh, uh, First, we functionalize, as I said, nanomaterials with the targeted ligand, make them active targetings or
Mhm.
active therapies or smart therapies. Okay. But thing is that in terms of the conventional chemotherapies,
Yes.
we have a chance to use nanomaterials for some addictive therapies or alternative therapies. For instance, we provide photodynamic therapies.
Mhm.
We provide photothermal therapies. This is also actually quite non-invasive therapies models. And also nanomaterials provide multifunctional therapy systems. What I mean is that if we functionalize nanomaterial with some uh, therapeutic drugs, some synthetic drugs, we have a chance to introduce chemotherapies. But in the meantime, nanomaterials has their intrinsic properties to produce high temperature under the near infrared light.
Mhm.
If we apply the near infrared light for some nanomaterials, especially for the gold nanoparticles, we have a chance to absorb these NIR laser light and convert it into heat. And some molecules also absorb this light and will be converted into superoxide radicals. That
Mhm.
means we have one nanomaterials conjugate systems, but we have uh, three three therapies models: chemotherapies, and also combination therapies, photodynamic, as also photothermal therapies by generation of heat and also super oxide radicals.
I see. So, from your perspective, so we can use it in passive targeting, in enhanced permeability and retention, in active targeting, like surface function like nanoparticles, like HER2 receptors and EGFR, and in some ligands like antibodies, peptides, and aptamers. And also, I think it's a major nanocarrier platform like liposomes, polymeric nanoparticles, even the amazing work you're doing with gold nanoparticles, which is a strong surface plasmon resonance. Even in dendrimers, I see that you're using as well as the carbon-based nanomaterials. Clearly, in cancer research, there is huge opportunity with nanotechnology in health, and cancer is one of the biggest issues we see around the globe. So I'm very, very curious your amazing work that you will be continuing in high impact translational domain in oncology, because clearly precision drug delivery, tumor targeting, and multimodal therapy integration at nanoscale is done amazingly with the AFROTURK group, and I'm so proud of your work as a member of the Turkish Academy of Science, Professor Özsoy.
Thank you very much. It's too much appreciated.
Thank you. Well, can I get your final messages for our African viewers, Ismail? From your perspective, what are your final messages in nanotechnology and health for our viewers?
Well, actually, for the viewers and for our audience, I definitely say that we have to follow the magic properties of the nanomaterials.
Amazing.
The major problem we as a scientist think about the major problem with the nanomaterials, definitely say some paradox about the toxicity associated properties of nanomaterials, the point which is what we have to consider actually. That's why OECD actually announced 11 candidates of nanomaterials which can be used for animal, also human models, like some metallic nanomaterials like cerium oxide, zinc oxide, gold nanoparticles, silvers. People should follow these particles. They have some promising properties even for near future. In the meantime, as you said, some carbon-based materials, we call them carbon family, like fullerenes, carbon nanotubes, graphene oxide. They have also some actually promising properties for dealing with actually or fighting with the cancers.
Absolutely.
In the meantime, some polymeric and micelle type of liposomal nanomaterials, they have also some actually opportunity to carry two or three different drugs in the same time in one carrier models.
Amazing.
So these 11 candidates, as OECD announced them, we should focus on these materials and we should think that there can be alternatives drugs compared to synthetic and conventional drugs for treatment of not only actually for cancer, also different types of diseases.
Professor Ismail Özsoy, it's been really greatly appreciated. I think this is taking me to making a proposal to actually organize a big nanotechnology conference in the future, ladies and gentlemen, because
definitely
we should consider that. Do you agree with that, Professor Özsoy?
I definitely agree with that. Actually, we have to consider it, and we have to probably make it a little fast for this organization.
Okay, sounds like a plan. Ladies and gentlemen, so this episode actually brought a new program which we will later announce about, this amazing nanotechnology forum or symposium or even a conference which will be shaping in the future. Again, in this episode, we talked about nanotechnology in health. We talked about the advantages of nanotechnology in healthcare compared to the traditional treatments. We talked about the nanomaterial, how they interact within the biological systems, whether it's human or animal. And especially we focused on the cancer treatment because there is targeted drug delivery, controlled release systems, photothermal and photodynamic therapy, even gene therapy and RNA delivery is now done through nanotechnology. And as a member of Academy of Science, Professor Ismail Özsoy is wide open for collaboration. And as a physician myself on the ground, I'm also wide open for collaborations, and probably will be with you if a future announcement about a big conference. This is your host, Dr. Selim Saray, physician, entrepreneur, venture architect. I'm so proud to bring global health an amazing leader, Professor Dr. Ismail Özsoy, which is known globally from United States to Europe, from Turkey to Africa. And I look forward to probably some more future episodes based on your questions in the future with Professor Dr. Ismail Özsoy. This is your host, Dr. Selim Salay. Take care and all the best. Wishing you a wonderful global health episode in the future. Take care.